Hi there, this is Dr. Shwetambara Sabharwal. I'd like to talk to you today about ADHD. ADHD slash ADD are not two different things. It's just that years ago it used to be called ADD, and now it has, now the term that's used is attention deficit hyperactivity disorder. And that actually is a little bit of a problem for me personally, because I don't appreciate the word disorder or deficit. We do respect that the APA has its hands full, and at some point we can address this concern. The entire problem begins with them being able to notice a lot more than others. They just have a different view of the world where they're processing, noticing, observing a lot of stimuli, thereby getting distracted. The reason I want us to understand this is, again, ADD, ADHD, hyperactivity, attention problems are words that are used far too loosely, without being clearly understood, not empathized with. We as parents, very often teachers, we're not aware of what this actually is, and we don't understand the psychopathology, we don't understand the neurobiology behind it, we don't understand the symptomatology, and we quickly use these terms. We panic when these terms are used. We are judgmental towards these terms. We fear them, and I understand all of that. And today, the reason I'm talking to you about it is to dispel all of that, hopefully. It is not a label for a naughty child, a lazy child. These are not children who procrastinate. These are not children who don't listen or defiant. So please differentiate between those. They get bored very fast. They need a lot more stimulus, a lot more going on with a particular activity or a task or a stimulus to keep their attention on it. The minute they, when they're trying to do something and then there is a distraction or there's something else that happens, they are quick to shift focus on that. So it's not that they're not able to focus. These are not kids who have IQ problems. These are not kids who have learning disability. So please understand and dispel all of those myths in your mind. The only thing that is happening over here is that they are getting so bored so fast that it affects their functionality. They are not able to complete their tasks. And the reason behind that is that they are not able to use language to self-regulate. So let's say I'm having a conversation with you, and I hear a beautiful bird song outside and I get distracted, which is very normal. It'll happen to a lot of us. Maybe some of you won't get distracted with bird song, but maybe like a loud thud or a lot of traffic sound or whatever. What we might be able to do is self-regulate, use language and say, hey, I'm doing something here right now, I need to pay attention to this. So I'll be able to do that. But someone with ADHD, if I had ADHD, I would get drawn to that bird song, and I would actually notice a lot more than somebody else would process bird song as. So that is the concern. It is a lower ability to use self-talk or language to manage one's own attention, to manage one's own behavior and self-direction. So typically kids walking into a lecture will see a group of friends who are free, who don't have a lecture at that time, and they will get distracted by it, and they will sit with them and chat and make great conversation, and they will forget all about the lecture. If you are an adult with ADHD, you'll find it very difficult to focus on people rambling about a conversation when you want to talk about different things. You're easily distracted by things happening around you. So it again and again, I'm reiterating, the concern is that they're not able to regulate their attention and their focus. So coming to symptoms and a few technicalities, there are 3 types of ADHD. The first one is the inattentive type, second is hyperactivity or impulsivity type, and the third is the combined type. For anybody to diagnose a child, please understand that there have to be 6 out of 9 symptoms under each type for 6 months, so much so that the functionality of the child has been affected either at home or in school or college, or for an adult to be affected at home or at work for it to be clinically diagnosed. So let's stop with our loose and quick labels and diagnoses of this. Of course, no one means bad. It's just habit. It's just, we need to find labels and explanations and closures on what's going on, answers to questions that we have. So please understand that this can be clinically diagnosed only by mental health experts, clinical psychologists, occupational therapists, psychiatrists, and maybe a few others. Maybe I'm missing out, but largely those. Certainly not in a household situation. There is a slight difficulty in these in the diagnostics, and all of us are aware of it. Typically, let's say if we use a rating scale that we want the teacher to fill and the parents to fill. Now, there is a chance of over-report or under-report or subjectivity in the report, no matter how objectively you ask a question. There are also a lot of broken families where the dad fills it separately and the mom fills it separately and the teacher fills it separately, and we have to try and collate all that, where somebody has, when the mom and dad are not agreeing with each other. So there are some diagnostic difficulties. So I usually go with an autist's observation and evaluation. That is my personal take on it, and I definitely need a good autist to see a kid that I am consulting with. Now we come to the causes. ADHD is genetic. Let's just understand that it is not a personality trait or a characteristic or something that you have done as a parent that is causing ADHD. Then there is a neurotransmitter imbalance. The two that are associated largely with it are dopamine and norepinephrine. So please understand the biology behind it. Trauma and difficult homes and whatever else we assume, a teacher's teaching style or a school's philosophy, those are not causes of ADHD. Now I want to explain something very interesting about ADHD. What is happening in the mind of a child or an adult? And I keep saying adult. I'll quickly add there that 50% of ADHD actually continues into adulthood, and very often doesn't get corrected, because you just, once somebody is an adult, you just assume that that's the personality and that's their working style. So 50% of people actually do not completely remit and continue with these symptoms in their adulthood. So I was actually very interested in explaining to you the difference in the way people with ADHD process information or pay attention. Now there are 3 kinds, but we'll talk about 2 because the third one isn't statistically highly supported. The first one is default type and the second is directive type. Now, sometime back I gave you the example of me getting distracted by bird song. If I have ADHD, my default attention or my default mode will be like, hey, go out and see what those birds are doing, or go out and check out the sunset, or the day is coming to an end and I need to do this and I need to do that. So that is default mode, where attention is going everywhere. And then there is a directive mode or a directive attention, which is basically controlled by the frontal cortex, which tells you, or basically self-talk or language tells you that no, leave all that beauty around, come back to this because this is significant, this is what you have committed to, this is the task that you want to complete. So essentially what is happening is that there is a gap in their ability to regulate, self-regulate into directive mode from default mode. They often function in default mode, and that thereby not completing a lot of their tasks that need to be done at that time. Then there is a third type where they have difficulty with emotional regulation, where they might have outbursts of feelings, etc., and they're not able to regulate feelings, but that's not statistically very well supported. So, how are we going to treat this? It's very important for us to understand that long lectures with kids with ADHD or adults with ADHD will not work. So as a counselor, I'm telling you that those 1 hour of therapy sessions, I'm really not sure if the kid has paid attention for the entire 45 minutes to 1 hour. I'm really not sure if that kid is walking out with a lot of that information. So then what will work? I think the first step, and I always feel that the first people to make an effective intervention are the primary caretakers, and that's parents. And long term, that's what works. We need to help them understand what is default and directed attention, and help them regulate this. So it's about practice. Get them to constantly identify, I'm getting carried away by default attention, I need to focus on directed attention. Please don't think that these words are some big jargon or big words too big for little kids. They get it. And focus on task completion. It is extremely important that you don't treat it as a disorder, and accept it. Don't judge it and say, you just think and perceive information differently. You see the world differently. The world talks to you differently. A lot more in the world talks to you. So it's very important that you give that message. Occupational therapists are able to help children develop attention, focus, and sustained attention or concentration. Work with task completion, work with sequential memory. So those are also that I heavily bank on. Now, there are conditions where children need to be given medication because there is a neurotransmitter component, and sometimes cases are extremely severe where a child just will not be able to sit down, just will not be able to complete any task, and sometimes medication needs to be given very carefully because a lot of older kids may misuse during the time of exams. So please always must be very, very vigilant about that. But all parents are very, very concerned. I am also very concerned about side effects. So side effects are not something that will cause any harm. They will just cause a little bit of fluctuation. They may not, side effect may be that it's not working. A side effect may be, let's say, they're not eating or they're not sleeping, and those need to be managed. Not sleeping, melatonin works very well. Not eating, maybe, give them the pill after they've eaten. So those side effects always need to be managed, but side effects is not a reason to not give medication if it is necessary. So please understand that there are some people who will need the medication, and if we are primary caretakers and if we are in that situation and that decision has to be made, side effects can be managed. And like I said, that there is no harm. It's just that one dose may suit or not. So very often psychiatrists are very open to managing doses, reduced dose, etc. There's also a concept of drug holidays, where during the summer holidays or during the winter holidays you can go off medication, where children don't have to attend school and college. So those are some possibilities. Some research also shows that omega-3 as a supplement in a very tiny way does help. So that's something that you can safely give. But one of my favorite treatments is mindfulness. Now, mindfulness is for you to get them to train themselves to self-regulate, identify when they're slipping into default mode, come back to directed mode, become mindful of just the way that they're looking at the world in a different manner, and use language effectively to bring them back. It's just something that with which you can empower them for the rest of their life. much longer lasting, and of course no worries at all of managing side effects. Practically speaking, these kids will work very well in study groups. Adults will work with someone else very well when they're obliged, that someone's coming over to work on the balance sheet and they better sit down and work on it. That brings me to a usual worry that parents have. Please know that these kids will be able to find great jobs. They will do a wonderful job in their life with business. I know of some doctors who have ADHD. I know of some CAs who have ADHD. I know one scientist who has ADHD. Please understand that they can be very successful working individuals, and the ability to notice every detail in their environment is a huge strength. People with ADHD are far more likely than others to actually start their own businesses and to be successful. So please understand, no more worry, no stress and anxiety and upset and anger or disappointment with your child having ADHD. And the last thing that I want to speak to you, which is extremely significant, is how do screens affect ADHD? Now, we don't have any research to prove that screens can cause ADHD. Like I said, ADHD is largely genetic, but screens do have a significant impact on how children choose to regulate themselves and their mood. Screens definitely impact mood. They definitely impact productivity. So a child with ADHD very often will choose to watch TV or play a game because it's much more stimulation than a Hindi worksheet. And they need that to hold their attention. So screens in a certain way are impacting them because they don't make better choices, because it becomes the natural preferred choice rather than physical activity, which they can actually really benefit from. They will not choose and regulate their attention to the directive or task mode attention, because that is not stimulating enough. It's boring. And I just lost power at that point. But I am done with what I had to say to you. So this is kind of perfect timing. Thanks for your patience. Thanks for listening. I do hope I busted some myths regarding ADHD. If you have questions, please do write in. I know that this has been longer than I imagined, but that is, a thing with me. I feel I just need to give all the information that I can give you safely. So I do hope there'll be lesser judgment, lesser confusion about what ADHD is. You do know how to deal with it. You do know how to identify it. This is not for you to diagnose. This is not a certificate course in you being, proficient in the diagnosis of ADHD. So please don't do that. Do reach out to mental health professionals. So please don't do that, and power is back. Do reach out to mental health professionals for diagnosis and interventions. But I've actually really felt very satisfied today having shared this with you, because this is such a misunderstood psychopathology. So once again, thank you for listening. Thank you for your patience. Take care. Bye-bye.